Namaste. Welcome to our webinar session. Today we have with us Dr. Gautam Tawari, UK trained specialist and sports surgeon at Apollo Hospitals, Navi, Mumbai. Today we will talk about sports injuries and their treatments. So doctor, my first question is, what are the common sport injuries that you've seen in your clinic?
Right. So, sports injuries that I commonly see in the clinic range from mild, moderate, severe, or from sprains, strains to broken bones and joint injuries to back pain and sometimes even head injuries.
So doctor, how should they be treated?
Treatment of sports injuries can be divided into two main categories. The first category is the early treatment of these injuries. Now, these early treatment requires protection of the part that is injured so that we don't injure it anymore. This is followed by generally rest, icing of the part, roughly about 20 minutes, 4-5 hourly, and elevation of the limb to reduce its swelling. We can also give patients some normal analgesic drugs or non-steroidal anti-inflammatories, and they'll help in the initial period. Once the initial period settles, either the injury settles down by itself if they are minor, but if they are major injuries, then definitive treatment is required to treat those injuries. These definitive treatment can range from extensive physiotherapy and training of the muscle to surgical intervention. And that is based largely on the investigations that we do to find out what definitive intervention or treatment is required for the injuries.
So doctor, is treatment different for sports individuals?
Definitely the treatment of injuries are different in sports individual. To give you an example, the commonest joints that get injured in sports individuals are knee, shoulder, elbow, hands. So in knee, the commonest injury is an ACL injury. Now, treating an ACL injury in a leisurely sportsman or a professional sportsman is completely different. In a leisurely, the recovery and the rehab takes good part of 6 months, whereas in a professional sports person, the recovery and the rehab is done within 3 months so that they can go back to sports early. Similarly, for shoulders, they often get shoulder dislocations or rotator cuff tears, which are treated a lot more aggressively and with a lot of intensive physiotherapists to get them back to sports. With regards to elbows, they can often get tennis elbows or hand fractures, hand ligament injuries, especially in cricketers. And these have to be treated a lot more accurately to get them back to sports early.
So doctor, what is the recovery program for the following treatment?
The recovery program for sports men and sports women is completely different. It's an entire teamwork between a good sports physiotherapist, a sports surgeon, and the athlete largely. However, the higher the athlete, we also involve the coach in training and early rehab of the sports person to be able to get back to sports and play his game properly.
Thank you so much, doctor, for today's session. I'm sure all our viewers will get so much of information regarding the sports injuries and their treatments. So thanks once again.
Thank you.